Hi guys, my name is Stephanie Crawford and I did my proposal on the comparison between the two tests that we use to test for C.Diff. So my question was, is the C.Diff quick check complete testing method more accurate than the Cetaphil expert C.Diff difficile test, kit test that we use? And that's just for the diagnosing C.Diff. So my abstract, I wrote, rapid testing for C.Diff is extremely important for providing an authentic and helpful diagnosis for patient care. This study will show how effective the C.Diff quick test is for diagnosing C.Diff. We will also evaluate this two-part testing method used for stools for patients that are suspected to have an infection. Results from this test will be compared with the Gene Expert C.Diff assay method, which is the current method used for testing at hospitals. And I chose those two because those are the two tests that we use at the hospital that I work at. So what we're going to be doing is testing the sensitivity and specificity of the QCC, which is the EIA quick test. And basically the EIA quick test is like a screening tool for the C.Diff. And with the results, the two-step testing for the EIA should show to be more effective, for the rapid and more reliable detection of the toxigenic C.Diff for sample stools. So my introduction, I wrote, C.Diff is a highly infectious toxin-producing gram-positive spore forming bacillus. So it's like a bacilli. Well, not bacilli, I'm sorry. Bacillus. The nasty bug is an anaerobic that can be very deadly. This infection is the number one infection that most healthcare institutions are fighting. We seem to have a lot of positives, definitely with more patients that are staying longer in the hospital. It's definitely easy to, for other patients to catch because it can be passed on if the nurses aren't properly cleaned or gowned correctly. So it says this infection is the number one infection that most healthcare institutions are fighting. This bacterium can also be the reason why many patients experience diarrhea while they are admitted to the hospital. Once this infection starts to spread, it's hard to be contained. Of course, it's very contagious. I remember maybe like a year ago, when my grandfather was alive, me and my son had went over to his house to go visit him. And, the day after, my son ended up getting sick. And when my sister took my granddad to the hospital, they just told him that he had an intestine infection. So they gave him some medicine, but they did not test him for the C.Diff. And I believe that I believe he had it because, the next day, as soon as we got home, my son got sick, my husband got sick, my daughter got sick, and I got sick. Fortunately for us, it didn't last that long. We were down for probably about 24, less than 48 hours. So we were pretty much able to, get our bearings back for it. But it's definitely a nasty little bug that will definitely have you going to the restroom. So the C.Diff is the most common microbacterial cause of healthcare associated infections in the hospital. And the cost is up to $4.8 billion each year just to try to treat the patients, just, PPE and everything else alone. Once the patients are treated with antibiotics, many patients develop gastrointestinal problems. This issue can range from diarrhea to severe colitis. And that's, I guess, many patients can develop those type of problems if they are not treated with antibiotics. Because if you're pretty much getting treated, it should knock the infection out, especially if your immune system is pretty much up to par, pretty good. So in many cases, the cause of these gastro problems is caused by the C.Diff toxogen strain. Even though this bacterium is considered part of your normal fecal flora, when the patient is treated with antibiotics that they do not need, this causes an imbalance in the intestines, which causes that bacteria, to, of course, overgrow. And once you have that overgrow, that's what's causing, the infection. And that's what it says down here. This thus causing the body to have an overgrowth of this bad bacteria. Because I know I said at the beginning, it says once patients are treated with antibiotics. But I meant to put in there as a typo. If the patients are not treated with antibiotics, the patients can develop gastro problems. So the non-toxigenic strands of the C.Diff do not carry the gene. The toxigenic strands of the C.Diff carry the genes encoded from the toxin A and toxin B. Most clinical symptoms are caused by the toxin A. So the toxin A is known as the enterotoxin that damages the tissue. So it could damage the inner lining and everything of your, intestines and stuff like that. The toxin B is the cytotoxin. And with the cytotoxin, I guess it's just letting you know that you have it, but it's not contagious. It's not, it's not infectious. It's just saying that you did have it, but you're not, it's not active at this moment or causing any issues at that moment. So as the infections begin to increase, so do the different methods of testing. In most laboratories, we're able to identify the two separate strains that cause the C.Diff. This fact is important with diagnosing the patient because it allows for proper treatment, since certain protocols have to be put in place when you have an active infection. So that was that's a great benefit with the C.Diff, the quick test, the EIA, because it has the two separate parts where it lets you know if the patient is positive for the toxogen or the antigen. If the patient is positive for the toxin, then you know that the patient has an active infection. You need to treat the patient. You need to make sure that you run the, proper PPE so that you don't cause any more, any other patients to be infected. With the antigen, it's just letting the doctor know and the nurse know that the patient previously had C.Diff, but it's not, it's not contagious. But it's just letting them know that they once did have it. So if the doctor, my sheets got out of whack, sorry. So if the doctor suspects that the patient has a C.Diff, is infected with the C.Diff, what happens is the sample is sent down to the lab to be cultured or to be tested. This process, before they were culturing it. So with them culturing it, this would cause a delay in patient results because it would take several days for the organism to grow. This was one of the main reasons why, they were pushing to try to get something that was a little bit quicker so we could diagnose the patient a lot faster. So that's the reason why that rapid test was put in place, because for one, it gave you a faster turnaround time for testing, which was way better, because you definitely need that, because if the patient is positive for you know, C. diff, you want to jump on it. You want to treat that patient, you know, right away. You don't want any type of delays. There are many different testing methods that are used for diagnosing patients. Since C. diff strains can produce toxigenic and non-toxigenic strains, it is recommended that the testing method be different. You know, you be able to tell the difference between the two toxins. So in my research, I plan to compare the C. diff, the quick test, you know, kit versus the Gene Expert C. diff assay kit. My goal is to see if the rapid testing method for the quick test provides accurate, rapid results. And both test methods are used, you know, pretty much, because we use both on a daily basis for testing. But as I stated before, the faster the turnaround, the better. So even with the quick test, your turnaround time is about 15 minutes. With the Gene Experts, is 45 minutes, but you just get a positive and negative. It just lets you know if it's positive or negative. It doesn't tell you if it doesn't differentiate the two, whether it's positive for the antigen or the toxin. So some of the methods. So this was a 12-month study, 1-year study. I know the previous studies may not have included specific criteria that the specimens needed to meet. Before this study, it would be different. For this study, we want to make sure that we are collecting specimens that meet certain criteria, which are stools that are either liquid or soft. Hard stool is not acceptable for testing. Because 9 times out of 10, if it's a form stool, the patient doesn't have C. diff. C. diff is going to be a more watery, runny stool, you know, things of that nature, soft. If you have a hard time interpreting what the soft stool is, I put if it sounds like a shaker, like rumpet shakers, then the specimen should be rejected because it's not going to be a good sample to be tested, testing for the patient. We also had a stool chart that you guys can use. You can look at to see, whether or not the sample is going to be acceptable or not. My samples will come patients. Our samples will come from patients that have been admitted to the hospital within a year. For this study, we will use patients that are 3 years of age and older, and they have to be admitted to the hospital for at least 3 to 5 days, because that will show us whether or not the infection is coming from within the hospital or is coming outside. If the patients get admitted that day and we test that day, we can't specify that it came from, in the hospital, the patient got affected from another patient in the hospital, or the patient got affected outside the hospital. Multiple samples will be collected. We will need to collect for this study, and this will make sure that we are receiving good samples for the study, because, sometimes you want to make sure that, most of the time you want to make sure you got fresh stool, coming down, because you can have an old growth of other bacteria in the stool. For specimen collection, we were using about 25 microliters of stool for testing. Fresh stool, frozen stool, or stools received in transport media are accepted for testing. Now, the ideal specimen for testing is less than 24 hours old. So fresh sample is always recommended, like I said before. Once we receive the sample, we will need to run the quick test as soon as possible. And normally when we receive it in the lab, as soon as we scan it in, we're running it right away, because we're focusing on turnaround time for our patients. Patient care is our number one goal. If for some reason we can't get the sample ran out within that time frame, we can freeze it at a negative 10 degrees Celsius. That will preserve everything for us and help minimize overgrowth. you know, that gives the sample a longer shelf life. But if we are freezing and unfreezing the specimen, it can result in a loss of toxigenic degradation. So you definitely don't want to do that. We definitely want to get it done and ran as soon as possible. The most popular method for testing for C. diff is a C. diff quick test, like I said before, because it's 15 minutes. Then let the doctor know they're positive for both, positive for one and not the other one, or both are negative. And it says, which is a rapid membrane enzyme immunoassay for the detection of the antigen and toxins A and B in a single reaction well. This test takes about 30 minutes to complete. It's a two-part test. The first part takes about 15 minutes to run. With that, you have like dilution and another reagent that you put in there. And then you add your stool, you let that sit for 15 minutes. You combine it, mix it, put it in your kit test, and let it sit in your kit test for 15 minutes. So while that's sitting, the first part, it looks like it's just detecting the antigen, while the second takes about 10 minutes and detects the toxin. Some hospitals still perform the C. diff using the gene expert, like I said before, and we do too. I know we receive in-house is normally the C. diff quick test, the EIA. Outpatient, we do the gene expert. I'm not for sure why we, it's certain ways that may have something to do with billing and stuff like that. I'm not for sure, but normally with in-house patients is the quick test EIA, and most outpatient samples, it's the gene expert. Then it says, test to find out a patient is positive for the bacterium, but it is not recommended. Reason is because this is a test not as sensitive as and that's the gene expert test, which is not as sensitive as the C. diff EIA, the quick test. The results for the test is only positive or negative, like I said before. It doesn't give you the breakdown of the difference between the toxogen or the antigen that the patient may be positive for. The quick test EIA is just a screening test to let the doctors know if the patient, is positive for the C. diff. It confirms the presence of the toxigenic C. diff by detecting toxins A and B in fecal stools from patients that are suspected of having C. diff. And of course, it's the most common method used by most doctors, especially in a hospital, to let them know if the patient is positive for C. diff. So for my literature review, the C. diff has caused more infections than any other bacterium out there. The highly contagious bacterium can easily spread through closed quarters such as nursing homes and hospitals. The C. diff has been an outgoing issue in most healthcare fields that, again, because we're having a hard time containing it. 1 in 6 people who've had C. diff will get it again within the next 2 to 8 weeks. 1 in 11 people over the age of 65 diagnosed with C. diff infection will die within a month from diagnosis. Some could say that the reason for the increased number of healthcare associated C. diff is the cause of patients being given antibiotics that they do not need. When you give the patients antibiotics that they do not need, it ends up sometimes, not all the time, causing an overgrowth of other bacteria because that you have in your body, but it becomes immune to, the more antibiotics you get, I feel like sometimes the more antibiotics you get, you start to become immune to them and stuff. So it kind of causes more damage than good. So it says, some could say the reason for the increased number of healthcare-associated C. diff is the cause of patients being given antibiotics that they do not need, hence causing the patient to have recurring infections. Studies have shown that 30 to 50% of antibiotics that are prescribed to patients in hospital are unnecessary and or incorrect. This issue can be one reason as to why we cannot get the infection under control. After treatment with antibiotics, many patients develop gastro problems. This issue can range from diarrhea to the colitis that I said before. In many cases, the cause of the gastro problems is caused by the toxic strain C. And, again, many of the symptoms associated with the disease is probably due to the toxic A. The bacterium produces the second toxin, known as toxin B, which is the non-toxigenic one, which is the cytotoxin. The toxin B is the toxin detected by the tissue culture, which is now used in many laboratories. So in conclusion, you can see that, to me, or even with some of the studies, that the quick test has a faster turnaround time because, again, that's our goal, to make sure we're doing everything we can for patient care. The diagnosis result is more accurate. The two-test method part is better than just getting a positive or negative because it breaks the two toxins down to antigen it just is antigen or toxin, so it breaks it down for you. Even though the C.Diff is just a screening, and it says it cannot confirm that the patient has an active infection, that's for the gene expert. It can't confirm it. Well, it just says positive and negative, but again, with the C.Diff, the quick test, you have the antigen and a toxin. The toxin is a active infection, where the antigen is letting you know that the patient has previously had C.Diff, but the infection is not active at this moment. But it just lets you know that the patient can definitely get it again. And it says that what the screen says, is definitely important because it definitely helps treating the patient more better. Lets the doctor know if the patient has an active infection. Since we're able to provide the two-step testing between the two, this response method of testing is less cost effective to the patient. This is, and to me, I feel like patient care is the most important thing, as well as the patient not spending money on unnecessary tests that they don't need. So to me, I felt like this was a logical reason because it is a little cheaper than the Gene Expert, the testing. So that's why I was like, yeah, I felt like it was a logical reason, especially for the patient as well as the doctors. You get cheaper tests, faster turnaround results, and that's just to help the patient. And on the rapid test, it helps infection control practices, and it also helps to diagnose the patient properly, to let the doctor know if the patient does have any type of active infection with the C.Diff. So that is all I have on my research paper in regards to whether or not the C.Diff quick test is better off or more accurate than the Gene Expert C.Diff testing. I'm also gonna post my notes and everything on there as well if you guys need to just take a look over anything and read it, because you really can't see any of my writing on the board right now. But I want to thank you guys for watching, and congratulations on your graduation.